suffer from frequent pain in your stomach or discomfort? Well, this could be because of your gallbladder. Hi, I'm Dr. Ritakshi, a clinical nutritionist, and today I'm going to discuss about gallbladder disease and gallstones. Gallbladder is a small pear-shaped organ that is located on your right side of the abdomen and right beneath the liver. So gallbladder basically stores bile juice which is secreted by the liver. Gallbladder is usually used to break down fats, and bile juice consists of pigments such as bilirubin, biliverdin, and cholesterol. Gallbladder disease is disease that is caused by any condition that affects the gallbladder, such as gallstones, cholecystitis, and biliary dyskinesia. So let's quickly understand these terms. So cholecystitis is the inflammation of gallbladder, and this usually occurs when there is bile juice that gets trapped in the gallbladder. Then we have biliary dyskinesia, which is a disorder that affects the movement of bile through the gallbladder. And this usually causes a lot of pain and digestive issues as well. Third, we have gallstones, which is a very common disease. So let's go and have a look at exactly what gallstones are. Gallstones are hard pebble-like pieces of material which is usually made up of hard cholesterol or bilirubin. Now these can block the bile duct when they get accumulated, and this causes a lot of severe pain, and if it's left untreated it could lead to other complications. So sometimes gallstones can be an emergency. So normally bile has enough chemicals to dissolve the cholesterol that enters through our liver, but if our liver starts excreting more cholesterol, then what happens is that there's not enough chemicals to dissolve this cholesterol, so they turn into crystals, and over time they become stones. Let's look at some of the signs and symptoms of gallstones. So first is abdomen pain. You would have severe pain on the right side of your abdomen. You'll have back pain as well, especially between your shoulder blades. You'll have nausea or vomiting. You can have jaundice, or yellowing of skin, yellowing of your eyes. Sometimes you have fever and chills. Now let's look at the risk factors for gallstones. So the first one is family history. So if anyone in your family has gallstones, then there is a chance, or you are at higher risk of getting gallstones as well. If you're a female, you have a higher chance of getting gallstones compared to men. And with being a woman, if you're fertile, then, or at the age of 40, you'll have a higher chance of developing gallstones. If you're having a high-fat diet, this is a risk factor for developing gallstones. Another risk factor would be if you are obese or overweight. This could lead to having gallstones as well. The risk factor for developing gallstones is if you have diabetes, and if you have any other medical conditions which are linked to the digestive system, such as IBD, irritable bowel disease, and specifically Crohn's disease. And also you can develop gallstones if you have liver cirrhosis as well. Now let's move on to the nutrition part. So let's discuss some of the dietary guidelines that can help you reduce gallstones, and also for having a good healthy gallbladder in overall, okay? The first one is, of course, we have to reduce the amount of saturated and trans fat intake. So trans fat and unsaturated fats are known as the unhealthy fats, and if we have a higher intake of these unhealthy fats, then there is a chance that there is an increase of cholesterol in our bile. And if there's not enough bile juices, then these cholesterol will turn into crystals and eventually become stones. So we should limit the intake in our food. These unhealthy fats like junk food, processed foods, canned foods, packaged foods, baked goods, these should all be taken in small amounts. Second is, of course, choose healthy fats. Now, yes, we have to limit the amount of unsaturated and trans fats, but we should also increase the intake of healthy fats, such as the polyunsaturated fats, known as monounsaturated fatty acids and polyunsaturated fatty acids. Now, these fatty acids are found in nuts, seeds, seed oil. Third is increasing your fiber intake. Now, if you have more fiber in your system, then there is less chances of getting constipation, and this can also reduce the risk of developing gallstones. And while fiber regulates the digestive systems, reduces the risk of constipation, which reduces the risk of formation of gallstones, another thing fiber does is it reduces the cholesterol levels in our bodies. So foods that are high in fiber are, of course, fruits, vegetables, whole grains, and legumes. So incorporate a lot of these in your meals, and we should aim to get at least 25 to 30 grams of fiber per day. Next, we should reduce the intake of sugar and refined carbohydrates. Now, if we have intake of a lot of sugar, or if we eat a lot of refined carbohydrates, you know that there is going to be an increase in insulin levels, and which is actually a risk factor for getting gallstones. So to avoid this, we should limit the amount of sugar we intake. So don't drink sugary drinks, don't eat candies, sweets, packaged foods, or any refined carbohydrates. So some vitamins and minerals that we can incorporate in our diet are vitamin C and magnesium. Now, vitamin C is an antioxidant which prevents from cell damage to our body, and vitamin C is usually known to prevent formation of gallstones through these properties. Now, foods that are high in vitamin C include the citrus fruits. We have kiwis, strawberries, bell peppers, and broccoli as well. Magnesium is a mineral that plays a role in muscle and nerve function as well as energy metabolism. It also has properties that prevent us from developing gallstones. Now, some of the foods that are high in magnesium include leafy greens, nuts and seeds, legumes, and whole grains as well. Next is staying hydrated. Now, drinking enough water will obviously prevent you from dehydration, which will also reduce the risk of developing gallstones. Now, water can also prevent from forming gallstones by keeping the bile diluted and keep it flowing. So we should aim to drink at least 8 glasses of water per day. The more, the better. So let's discuss prevention of gallstones. Now, first is, of course, we have to maintain a healthy weight. Now, this can be done with exercise and diet. So we should exercise regularly because, as we learned before, obesity and being overweight is a risk factor for developing gallstones. So exercise, eat a healthy diet, maintain your weight, lose weight if you're overweight. Eat a healthy diet. Now, make sure that your diet is balanced. It has limited amounts of saturated and trans fat, which are a risk factor for developing gallstones. and make sure you have healthy fats, which are coming from your nuts and seeds, fatty fish like salmon, avocado. Make sure you have lots of fiber in your diet, which is coming again from fruits and vegetables, whole grains, and drink lots of water as well. So make sure that you maintain a healthy diet, you exercise regularly, stay hydrated, make sure your vitamins and minerals are also in check, and don't lose weight too much, like too rapidly at once, because that's also going to be a way like of developing gallstones. Take it slowly, take it easy, but make sure you are not overweight or obese. And if you have any family history of gallstones, make sure you get your checkups done, check your cholesterol levels, talk to your doctor, get yourself tested, and because prevention, of course, is better than getting the disease itself. So the treatment of gallbladder disease, including all the ones that we have mentioned, usually depends on which type of gallbladder disease you have and what's the severity of the disease. Now, in some cases, just making some healthy life choices and making some modifications in diet and maybe taking some medication can prevent you from developing any emergency situations or severity of the disease. But in some cases, what happens is your gallbladder stops functioning properly, and sometimes we have to do surgery to remove the gallbladder, and this usually happens in severe cases. But because of unhealthy diets these days, we are seeing a lot of development in gallbladder diseases, and especially formation of gallstones. So by taking care of your gallbladder through exercise and diet, you can reduce the risk of developing gallstones and other gallbladder diseases by a very large extent. So make sure that you start incorporating all these foods in your diet, stay hydrated, exercise regularly, eat a balanced diet, and if you have any problem, immediately you should go see your doctor. If you found this video helpful, or if you like this video, please make sure to like this video, share this video with your friends and family, and make sure to subscribe my channel for more videos like this. And if you have any questions, make sure to leave them in the comments and I'll make sure to get back to you as soon as possible. And of course, you can also leave any topics or any disease, any nutritional tips that you would like for me to review on this channel. I would happily do so. Thank you for joining in. Bye.